down the street. Well, she had a baby, and I heard she fell out. It rotted down there, and it killed her.
Hello. My name is Reese without her spoon, and I'll be your nurse today. And we're bringing Sweet Bridget back to you. Can you give me your name and your date of birth?
It's Tyler Tatum, and my birthday is February 28th, 1994.
Okay, great. Well, I have two nursing students with me today, Miss Brittany and Miss Gloria. Do you mind if they help me with your care?
No, I don't mind at all. We have to sometime.
Okay, sounds great. It seems like y'all are having a serious conversation in here. Do you have any questions that I can maybe clear up for you?
Actually, yes.
Oh, yes. Tell her about how some people get all infected down there, like Noreen on General Hospital.
Sure, I can definitely share some info about postpartum infections. However, if you don't mind, I think this would be a great time for me to share with the nursing students and give them a chance to teach you about postpartum infections.
Okay, I don't mind at all. Maybe we can learn about this together.
So, Brittany, can you tell Ms. Tatum about postpartum infections? I think we should start with what a postpartum infection actually is.
Well, I would love to. According to our nursing textbook, a postpartum infection is any infection that occurs within 28 days after a miscarriage, abortion, or birth. In the U.S. in particular, the definition is a fever of 100.4 or more on 2 days in a row in your first 10 days postpartum.
Yes, that's correct. What are some specific examples of postpartum infections?
Well, some examples are wound infection, urinary tract infection, and mastitis. The most common infection, however, is endometritis, which is inflammation of the uterus.
Great.
Will I get any of those infections?
Oh, you probably will. You know our family's luck.
Well, we can't determine if you will for sure get one of these postpartum infections or not. What we can do, however, is look at your health history and see if you have any of the risk factors that would make you more susceptible to attaining one of these infections.
Some increased risk factors for having postpartum infections are seen in women with prolonged rupture of the membranes, prolonged labor, or intrauterine monitoring of contractions or fetal heart rate.
There are also some factors that can predispose a mother to these infections before being pregnant. So these include having a history of deep vein thrombosis, urinary tract infections, mastitis, or pneumonia. Women who are diabetics, alcoholics, drug abusers, immunosuppressed, anemic, or are malnourished are also at higher risk.
I don't feel like any of these really apply to me, so I shouldn't have to be worried about getting any of these infections, should I?
Well, there are a few things that put you at risk during the labor and birthing process. Having an epidural, having a urinary catheter put in, or having an episiotomy can increase your chance for risk. The good news is that we determine those risk factors so that we can be on top of it before you contract an infection.
And if we're continually monitoring, we can definitely discover and treat them early on.
Great, I'll do whatever you all tell me to do so that I don't have to worry about getting one of these horrible infections.
Oh, yes, we'll do anything to make sure she doesn't end up like that poor lady's cousin.
So let's talk about the most common one first. That's endometritis. This specific infection is often related to medical procedures that allow for bacteria to enter your uterus through your cervix.
Oh.
Although you may not be able to prevent having these procedures performed, we can try to detect the early signs and symptoms of this infection.
And some of the signs and symptoms that both you and your health provider need to be looking out for are fever and chills, an increased pulse rate, nausea and decreased appetite, fatigue, pain in your pelvis, uterine tenderness, and an increased amount of foul-smelling bloody discharge called lochia.
If you were to develop endometritis, it's important to drink plenty of fluids and stay well rested. Pain relief and intravenous antibiotics will treat this infection as well.
The next thing that we want to be looking for are signs of infections at the wound site, which can be related to your episiotomy or your vaginal tearing. Because these sites are, for the most part, external, we can try to maintain a clean site free from bacteria to prevent the healing process.
As part of our assessment, hairy pads will constantly be monitored and changed when soiled. Cleaning the wound and administering antibiotics when necessary will also be performed. We will want to watch for any warning signs of redness, swelling, increased warmth, pain or purulent drainage around your wound, and then also assess the anus for involvement. We want to make sure that your incision site is not separating.
The last infection that we want to teach you a little bit about are UTIs, or urinary tract infections.
Oh, yes. I have had my fair share of UTIs. As soon as I sat down, I had to pop right back up again and go to the bathroom.
Yes, urinary frequency is a common side effect of UTIs. Also, it can cause pain or burning sensation when you urinate, and it's really important that you void often and drink lots of fluids. Also, it's really good practice to wipe from front to back after you're using the restroom to prevent transmission of bacteria into your urethra.
Like with any infection, the first thing that we may notice will be a fever. So that's something that we're going to be monitoring for and see if we have any symptoms of that.
After birth, the ureters and renal pelvis are dilated, which can cause urinary stasis, which is an excellent medium for bacteria growth. Also, mothers that get an epidural or other form of analgesia may have an impaired sensation to urinate, causing them to have a full bladder for a prolonged period of time. These risk factors can continue for up to 6 weeks after birth as body goes through physical changes to return to the pre-pregnant state.
Yes, that is why we want to assess for bladder distension, pain when you urinate, and the adequacy of your urinary elimination.
And I forgot to mention, there is something called mastitis, which is an infection that can cause inadequate removal of milk from one or both of your breasts, usually just one. Brittany, Gloria, what are some of the risk factors and symptoms that you may be looking for with mastitis, and how can we treat this infection?
So some of the risk factors that can lead to mastitis include engorgement, inadequate drainage of the breast milk, plugged ducts, and also wearing constrictive bras. We would want to be cautious of any manifestations of pain, redness, warmth, tenderness, swelling, and induration of your breast tissue. Some systemic signs that we want to be monitoring for are fever, muscle aches, chills, headache, and malaise.
And if you do happen to develop mastitis, it's really important that you continue to breastfeed or pump. Also, it's important to apply ice packs before you start breastfeeding, or cabbage leaves, and take your prescribed antibiotics regularly. In severe cases, surgical drainage may be necessary to correct this infection.
Girls, y'all did such a great job educating Miss Tatum about all of the signs and symptoms of the different postpartum infections. Do you have any questions for us?
No, not at the moment. Thank you for teaching me about all these problems that can happen to me. You all had so much information on all these issues. I feel better now that I know what signs and symptoms of infection I should be looking for. With this new baby at home, I really don't know that I'll have much time to be getting sick.
Well, we hope we didn't overwhelm you with any of these facts and info. The main thing to remember is that you need to stay hydrated, get a lot of rest, monitor for changes in your health, and make sure that you're just taking time to take care of yourself. I'll make sure you have some great online resources, pamphlets, and other numbers to call if you have any other kind of questions.
Okay, thank you.
Okay, girls, y'all ready to go? We've got to go make our rounds.
Yep.
Okay.
Nice to meet you.
We'll be back in to check on you. Girls, y'all did such a great job teaching and educating about all of the postpartum infections.
Thank you.
Let's go check on our other babies.
Sounds good.
As I look around, they don't do it like my click, 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 click. And all these bad man, they want the